I'm Yuna, this is Matt and Phan. We're here to discuss our device, the eCool system. Radiofrequency ablation is a widely practiced procedure to treat atrial fibrillation. With any procedure, complications can occur. One such complication after left atrial ablation is damage of the esophageal walls, leading to the formation of an atrioesophageal fistula in the posterior wall of the left atrium. Although very rare, this consequence is very problematic and often leads to death of the patient. Our healthcare consultants advise us that surgical, cardiac, and esophageal repairs performed as an attempt to save the life. However, more promising methods would be to find a way to prevent this. Through extensive brainstorming focusing on the user needs, we've come up with the eCool system, a small, cost-effective device that provides cooling the esophageal lining near the pulmonary veins during RF ablation. We're in the early stages of development and ask for your help in funding further development of our product. Matt and Phan will further discuss marketing and prototyping.
So over 2 million Americans suffer from atrial fibrillation, with around 160,000 cases each year. This is mainly due to the increasing age population and the obesity epidemic. Our idea is unique as it prevents the burning from ablation in the throat, which currently only a temperature monitor is used for. Some issues that we actively will try to prevent will be leakage of coolant and the control for insertion in the throat. This treatment is necessary as RF electrical current is used to burn abnormal heart tissues, and doctors need to prevent overburning. Our team for the eCool system will consist of an electrophysiologist and nurses for consultation, a FDA expert, a biomedical device engineer for the design process, a chemical engineer for the cooling agent, and a marketer and accountant. We found the need for this project from looking at current catheter ablation issues and plan to develop prototypes with expert input in order to create a complete system which can then be patented and we can perform pivotal clinical trials with in order to gain FDA approval and eventually market the device. This marketing will be done through a press release after FDA approval and through contacting hospitals that will commonly treat atrial fibrillation.
Realistically, if the device works as intended, it should be used in every hospital in the US that performs this atrial fibrillation, as it lowers the risk of atrial esophageal fistula and preventing open heart surgery and death. The device is built using a Peltier plate, which can allow cooling of the tissue even below ambient temperature. We will test the temperature cooling device quality and maneuverability to ensure the safety and efficacy and feasibility of the device. From analyzing other category device, we assume that the eCool system will sell for around $500, while the material will cost around $50. Prototypes will start on SolidWorks and then 3D printing, and finally we will choose the material and the cooling agent. We'll use the clinical trials to verify and validate it to prevent burning and is safe, getting evidence from temperature monitoring along with the biocompatibilities, safety, quality, and robustness of the device.